Hello there again, this is John, and this is chapter 12, your scene size up chapter. First thing I wanted to talk about is just basically maintaining your flexibility on calls. You'll go on calls that are dispatched as one thing, and when you get there, they're entirely different. Or even in the middle of the call, you're going to encounter these changes that occur. And if you're not flexible, if you don't keep an open mind about the situation and adapt and adjust to these changes, um, you can be harmed, obviously. The patient can be harmed, and any bystanders as well. So it's really important to always be prepared for anything that can occur because the calls that I go on, in my experience, has been they do change. Things happen, and you got to adjust to those changes. Just be prepared, essentially. Now, scene size up. Obviously, scene safety is our highest priority, and it's a dynamic, ongoing assessment of the scene safety. It's never really ends throughout the entire call. If you put the blinders on and you focus solely on the patient and you forget about scene safety, that's when bad things happen, essentially. Now, the mechanism of injury, like this car right here rolled over in this ditch, that's basically a mechanism of injury. This person in the car more than likely has some type of traumatic injury. Nature of illness relates to people who have medical problems. This would be diabetes, stroke, seizure, heart attack, the flu, whatever it might be. It's a medical problem essentially. What we do run into though is we have people who are actually both. For instance, you have a person who has a stroke while driving their car and they crash their car. So now you have a person who has a medical problem, is having a stroke, but they also have traumatic injuries from the accident. So that's why when you're doing your patient assessment, you have to realize that this, what came first essentially. Number of patients should be somewhat self-explanatory. You arrive on scene to a traffic accident, there's a 7-car pileup. Before you leave the fire truck or before you leave the ambulance, you figure you're going to try to count roughly how many patients there are. Now, obviously, if these are all being driven, that means there's at least one person per car. So you got at least 7 patients there. So you need more ambulances, you need more fire trucks. You need the police, you need the CHP. So you're going to call for additional resources before you leave your apparatus. And you're going to get those resources heading towards you, whatever they might be. And then if it turns out in the end you don't really need them, well, then you just cancel them. It's not a big deal. And remember too, is throughout the entire call, you're going to consider spinal motion restriction. And the reason why this is because, again, our scene is dynamic. Things change. For instance, you call to a person with a chest pain. They're having a heart attack. You're treating them for chest pain. In the middle of your assessment and your treatment, the patient says, oh yeah, oh by the way, I was walking down my hallway in my house because my chest pain got so bad, I fainted and I hit my head and my neck hurts. So now you have a person who's having a cardiac problem who also has a possible spinal injury. So do they get spinal motion restriction? Sure they do. So again, there's that flexibility we talked about. Now this is a dispatcher, and this is the person who's going to be sending you the information you need to go to your call. The most important piece of information you need for any call is where it is. Location, location, location. They're going to tell you all kinds of cool stuff. They're going to tell you of the patient's chief complaint. They're going to tell you if it's a traffic accident or if it's a fall or a gunshot wound. But those are just arbitrary coded numbers or coded statements. We don't know exactly what it is until we get there. And remember, where she gets her information from is from someone who's called 911. And that person who called 911 maybe gave some lousy information. It got filtered a few times. So by the time it gets to us, it's pretty funky. So again, all you really need to know is where is this call? Where am I going, essentially? How do I get there? Once you get there, then you can make a scene size of determination. You can determine whether this is a medical problem or a trauma problem, additional resources and all that. Now again, scene safety, you're going to have on your gloves, your safety glasses, I guess now it's going to be your N95 mask, and you're going to proceed. Now, this picture right here, I'd be a little concerned. It's assuming that it's late at night. He's got a flashlight on anyway. He's around the backside of a building. He's by himself. Probably not the best place to be. You never really want to enter a building or around the back of a building unless you got people with you, like fire or your partner or some police or something like that. Because again, it doesn't matter the neighborhood. It could be Rancho Santa Fe, or it could be South Bay, or it could be East County. It could be Solana Beach. Anywhere you can encounter bad people. So you don't let your guard drop. Once you're at scene, you're going to assess the scene. And remember, like looking at this traffic accident in the lower right side of the screen, it's a very significant mechanism of injury. The problem with all this is that what you're focused in on those two cars, and there's some critically injured people in those cars more than likely. What you forget to look at is that down the street, about a half a block, there's a third vehicle that was struck, and there's people in that car as well. So if you don't give a complete 360 view of the area and kind of get a general idea like what happened here. Anyone ever play pool? When you hit the pool, the balls with the pool cue, and the balls bounce all different directions. Cars do the same thing. Get 3 or 4 cars in an intersection, and they go ping pong ping all different directions. So this is your total scene. You're going to make sure before you enter that car that the car is stabilized, the airbags if they have been deployed or if they have not been deployed. Any fuel on the ground, any traffic coming by that might endanger you or the patient. And if you're in an ambulance or a fire truck, use that ambulance or fire truck, that apparatus, as a gigantic barrier between yourself, your crew, and the traffic. So position that piece of apparatus strategically to protect the scene, essentially. Now, obviously, you walk into something like this. This is not something we do. We're going to back away and call the people that know how to deal with this. So anything like water rescues, toxic substances, low oxygen areas, going into a burning building, obviously that's for firefighters who are properly equipped. Anyone going into this situation, some hazmat experts, lifeguards for the water rescue, you guys get the idea. Don't try to be heroes because most heroes are dead, and we want to try to avoid that. Also remember too that we do wear uniforms. We have badges, and we have like great little patches and stuff like that. And guess what we look like? Like cops. And one thing about cops though is police have guns, and they have bullet resistant vests. We don't, unfortunately. So we can't shoot back, and we don't have any armor to help us. So some crazy person with a gun sees someone with a badge and a uniform, and they start shooting. So when you're at scene, on the scene of some type of officer-involved event, and you're rendering care to the injured people that are there, and there's a guy across the street with a gun, you all look like cops, and they're not going to differentiate, unfortunately. They're just going to start shooting. So be careful about that. When you're approaching vehicles, a lot of times you'll get called for a man slumped over the steering wheel on the side of the freeway or on a side street somewhere. Someone walks by and sees this guy passed out in his car. Don't just start banging on the window. Get a good full view of what's going on inside that car first. Like peek in the windows first from a distance and see is there any weapons, any signs of any type of a suicide thing going on. You don't want to just wake this guy up, startle him. He might have a gun and shoot you. So again, be careful, protect yourselves. And just because cops are there doesn't mean that the scene is safe. Sometimes actually the presence of police makes the scene more unsafe, because then the gangbangers come back, or the assailant comes back, or whatever you want to call them, and they start shooting to try to get to the person that they shot previously. And then don't automatically assume police have disarmed your patient. I've been on a number of these calls where the police have said the patient was disarmed, and I pulled switchblades out of their pockets and folding knives and all kinds of stuff out of their pockets after the police had already arrested them, handcuffed them, and said that they had been searched. They weren't. So I'm not faulting the cops. I mean, we're all human, we make mistakes, but it's your job to be safe. Uh, Carefully check their pockets. Don't start cramming your hands into their pockets because they might have sharp objects, needles, things like that. But gently pat them down carefully. If you feel like some kind of weird bulge-like thing in their pockets, have the police pull it out if they're still there. Now, controlling the scene, one of your jobs is going to be scene control, especially if the fire department isn't there. Normally, the captain on the fire truck is the safety officer, and he or she will take the role of scene control person, essentially. They'll call in police officers, they'll cordon off the area, whatever you need. The problem is they're not always there. It's just you and your partner. So if you feel that you cannot control the scene, it's just best to get out of there. Like, for instance, you go into a bar for a person who's fallen off a bar stool. Not an uncommon call, let me tell you. And you go in there, and guess what's in bars? Drunks. And drunks can be belligerent, they can be happy, they can be all kinds of things. They want to help you out. They think you're attacking their buddy. They want to beat you up. So it's a really unstable environment. So what's the best thing to do? Is get them out of there, right? So you put the person on the gurney, and you wheel them out the door, put them in the back of your ambulance, shut the doors, lock the ambulance, and then treat your patient. So if you can't control the scene, you leave. If you can control the scene and you can stabilize the patient on scene, that's great. But you got to make that determination at some point. If you go into someone's house and it's dark, open up the curtains, turn on the lights. If there's no lights in the house, bring some lights in. The fire department has all different kinds of lights they can bring in for that. If you move furniture, if the patient's in the back room and it's cramped and you can't really work on the patient, slide them out into some place where you can work on them. You can't work on people all crunched up against a piece of furniture. The one thing about all this is if you do go into a person's house and you do move a lot of furniture to get people, moving out of the house, the patient, I mean, if there are fire service there, or there are firefighters there, or people to help you anyway, once the patient's been stabilized, they're out of that environment, they're stabilized, have someone go back in and put the furniture back where you found it. It's just common courtesy. Keep what's called situational awareness, essentially. So maintain an escape route, know where the exits are with that, and again, be open-minded at all times. Now, again, we're going to determine the nature of the problem. Is it medical or is it a trauma patient? Now, again, this is that same picture. It looks pretty serious to me. Someone's critically injured, maybe even died in this, but the person who caused this accident might have caused it because of a medical problem. So that's why we check blood sugar levels and we ask questions about what happened and how it happened, and that helps guide us into what might really be going on here. And then with the mechanism of injury, we think about what's called the index of suspicion. And the higher the index of suspicion, the greater the chance of this person having a serious traumatic injury. Again, this is that same picture, serious accident, serious injuries with this. But again, not everyone, you'd be surprised on car accidents that I've been on where I've seen cars just about this mangled and the driver standing there talking on a cell phone. Now, just because he's standing there talking on a cell phone doesn't mean he's not injured. But it does mean that he's a pretty damn lucky guy, frankly. Now, different types of injuries. Falls are the Number one cause of injury to the elderly population. They fall a lot for all different reasons. They fall a lot because of medical reasons. They get dizzy, they faint, they fall, they crash their car, they have diabetic problems, strokes, all those great things. Now, when it comes to talking to the patient and determining what happened, for me, the number one question for this patient right here is why they fell. Now, I know I can tell the distance they fell. It's roughly about 15, 16 feet or so, which is a significant distance. I can see they fell on the floor onto their back, so I can see that. But for me, it's like, why did you fall? Now, if the patient says, I was up there painting the ceiling and I tripped over a nail and I lost my balance and fell, well, that's a trauma patient who's fallen. What if he said, I was up there painting, I suddenly got really dizzy, my left arm became weak, and I fell. So this is a person I'm thinking now that actually had a stroke while at work and then fell because of the stroke. So it's really important. We really want to know why this person fell if we can find out. Car accidents, common things that you go on. What you want to look for is most cars nowadays are designed to crumple and fall apart upon impact. Just a way of kind of moving the energy away from the patient compartment. This little diagram right here, this red rectangle, that's the life module of a vehicle. And everything around that life module is designed to kind of redirect the energy away from that particular area. So if I go on an accident and the front end's all crumpled in and the back end's all crumpled in and the doors are crumpled in, but there's no intrusion, that red rectangle has not been disturbed in any way. And I'm talking three-dimensionally here. I'm talking about top, bottom, side to side, front to back. So that cube, that three-dimensional cube, has not been intruded upon significantly, then the car did its job. And it's very unlikely the person inside that vehicle, as long as they were restrained properly, has any serious injuries. If you have significant deformity into that cube, that red cube, then you can pretty much guess that the car did not do its job. It did not move that energy away from the patient, or rerouted it around the patient, should I say, but the energy entered that compartment, that cube, and the patient could have some serious injuries. Now, motorcycle accidents, pretty much self-explanatory. They don't call them murder cycles for nothing. If the person just high-sides his motorcycle or lays it down for one reason or another, and he has proper safety gear on and there's no other vehicles involved, it's more than likely he will not have a significant injury. He might break an arm or a leg, he might have some road rash, but usually people survive pretty well. When you involve a vehicle like another car or a truck, usually that's when things get bad, because then the truck or the car hits them and runs them over or throws them for 20, 30 feet, and that's how they get seriously injured. So again, you want to look at like what happened, how fast were you going, what did you hit, why did you crash, what hit you? Lovely questions. If it's not some kind of traumatic injury, then think about, is this a nature of illness? And this is where you're going to arrive on scene. You're going to inspect the scene for clues. Are there any empty alcohol bottles laying around? Any kind of drug use, some kind of needles or heroin or something like that? Are there any prescription medications? The bottles are empty because they overdosed, or empty because they're out of it, and the reason why they're feeling bad today is because they don't have their medications. So find all these different scenes, smell for, they'll have incontinence of stool or urine, they can vomit. Those are all signs of what might be going on here. Get your number of patients down, call additional resources like I talked about earlier. And again, resources can be anything from the fire department, the police department, rescue, helicopter. Even SDG&E could be a resource if there's a car into like a power pole. And finally on this is the first component of your patient assessment, scene size up. Scene safety, standard precautions, which consists of gloves, safety glasses, and now a mask. We're going to determine whether this is a mechanism of injury versus the nature of illness. We're going to count a number of patients. We're going to call additional resources, and then we're going to consider spinal precautions at all times throughout the call. And then we're done with chapter 12.